reason I'm here is this is famous as the best pre-med event in the galaxy. So that's why I'm here. And I just can't thank Dr. Pomeroy, my good friend, the folks at American River, and the AMSA folks for helping me get out here. I am going to lead off, and I'm also going to be crisp, because Dr. Shannon and I want to get you back on schedule as much as we can. But I'm going to lead off with the questions I had. 38 years ago, I was essentially ready to graduate with a degree in philosophy, believe it or not, working as a construction worker. My father didn't go to high school. First in my family, my brothers and I were the first in our family to go to college. Maybe we have a few things in common with some of you. I just didn't think it was conceivable that I would become a physician. Is it something I did or didn't do? So Jobin, I won't go back over what the AMC is. We represent the MD granting medical schools and the teaching hospitals that are associated with them, but for you, yes. You will know us by our role in the life cycle. The MCAT as an exam, the AMCAS as the admission form, and then ERAS, which many of you haven't heard of, which is the system that helps you match with a residency after you receive your medical degree. But these are the core questions for you. What would a career in medicine really be like? I urge you from this day forward to drop the fantasy. For me, it was Marcus Welby. You want to be Dr. McDreamy or Meredith Grey. Put that aside. Not because it isn't fun. It is fun, and the shows are funny, too. But because the reality is very different. It is that ER where Dr. Pomeroy steps out of her role and pushes a patient to the CAT scan because they're in need. And it is a great reality. And it's a great reality because of something she mentioned, the values underpinning it all. It's the Hippocratic Oath. Think of it. Has been around for millennia. And it doesn't just apply to medicine. It permeates the health professions in terms of these core values of doing good and always avoiding harm to others. That's a very rich and rewarding tradition. And it means that medicine, you will hear me and others say, it doesn't feel like a job. It does feel like a calling. That's what a career in medicine is really like. This is probably the question that I found personally most daunting. The notion of still being in school in the 32nd grade was more than a little off-putting. You know, I started doing what many of you do, adding up the years. You know, what if that residency and fellowship extends out to one of the 6-7-year training programs plus? Could I imagine how long it would take me to get out to practice? I also urge you to put that notion aside. The reality is this is true lifelong learning. It starts at the very beginning and it never ends. You keep learning. It doesn't feel like a series of graduations waiting for some distant, better future. It feels like a rich existence day to day in which you're always growing. So don't worry about the time, because the time will fly legitimately. Those 38 years have flown for me. Now, I admit, I'm the first to admit, that there's a little point in the middle there that you have to get to start earning a salary. But even that, as I'm going to mention in a moment, can be managed. Many of us feared it. We all managed it. This is the true continuum, and this is what you could enter that will last a lifetime. I may retire from employment in the profession. I'll never stop being a doctor. The other great thing about this continuum is we finally figuring out that one size doesn't fit all. Many of you in this room did not leave the womb imagining you were going to go to medical school, but instead you fit one of these other pathways. I was kind of a mix of the second and third pathway. I was non-traditional and I had a non-pre-med degree. I went back as a post-baccalaureate student, really, to prepare myself for medical school. And in a sense, I was aspiring. Much of my coursework was essentially something not unlike a community college. We are now realizing that some of the best talent in medicine resides in these other pathways. The other thing we're waking up to, which is very important for many of you, is we're realizing that some of us may have to leave practice for some reason at some point and return. Right now, if I wanted to return to day-to-day practice, I'd come and ask Dr. Pomeroy to put me back in one of her residencies so that I could regain the kind of level of competence I would want to have with patients. That will be more and more common, and schools and residency programs are ready to accommodate that. So that's how long it would be. It would be wonderful from beginning to end, and it would be lifelong. But then we get down to the practicalities. Could I get into medical school? I'm going to give you some facts, some data, as I think Dr. Shannon may. Again, don't believe the myths. Pay attention to the facts. This is data hot off the press. Actually, it isn't even public yet on what we saw in the MD granting schools this year. A total of 42,000 applicants, but 19,000 of those, roughly half of them, got an acceptance. That's a pretty good ratio, even though I still hear myths that make it look much, much, much more challenging than this. It's interesting, if you look at the acceptances in the matriculants, it's curious that 1,000 people get an acceptance but then don't matriculate. I think many of them actually do come back to medicine but do a service program in between. But those numbers will increase, and the reason they will increase is we have a huge challenge. Without going into the details, if you look at all the variables at work around determining how many doctors this country needs, we have a demand curve that looks like the top curve, but the supply curve isn't keeping pace with that. We have to expand medical education in this country. That means more places for applicants. These are the data on MD granting schools. These are all schools, including a couple in California that are in various stages of discussion or planning. There were 4 medical schools this year, MD granting schools, that just admitted their first class. But even more than that, when you look at our projections, a lot of the expansion is coming from schools that are already in existence. I'm not sure if Davis has expanded its class size at all, but those schools that weren't at capacity have built up to capacity, and that's creating more potential places that make it more possible for you to be accepted. Okay, you have to put this slide up. That maybe looks a little daunting too, especially if you had some diversions early in your college career. But this does not mean you have to attain those numbers in order to gain entry to medical school. Those are averages. And always remember, averages don't speak to the individual case. It is not all about grades and test scores. And the people here today that you'll have a chance to talk to who work in admissions will be the first to tell you about that. So when you pick up, this is a publication we have that many of you get to be a kind of guide to different schools. When you look at it, do not dwell on the numbers. Pay attention to the other things that are in this book about each school and its approach to what's now called holistic admissions. It's the notion that you're a whole person. You're much more than your MCAT and GPA, and schools are more and more focused on ways to get at that picture of you. I would just go back and say, we're trying to change the MCAT itself to reflect this. For decades, the MCAT was strongly shaped by the traditional pre-med courses, chemistry, physics, calculus, organic chemistry. More and more schools have realized that it goes far beyond that. I have had in my career leading health systems, I've had to discipline physicians. I've had to ask students to leave medical school. It was rarely because they had inadequate calculus. It was often, typically, that they failed as a person. We're trying to get better and better at looking at that person. We're trying to change the MCAT to make it a better tool at assessing broader aspects of a person. We should care as much about your sense of things like social justice as we do about your quantitative abilities. Here's another big one. Can I afford it? Yes. Yes, you can. It looks pretty frightening. Average indebtedness of the MD school graduates this past year was about $150,000, much of that in loans. I hear the audible groan from all 5 lecture halls. But it can be managed, and without going into great detail, because I think you'll have other opportunities to hear about this, there's an incredible toolkit. If you go to the AAMC website, you'll see our information on FIRST, financial information, resources, services, tools for medical education. Look at all of those tools that you can use to really think through the question of the affordability of a medical education. Even better than that, you've got something that can make it more affordable. You have a service ethic. Think seriously about the National Health Service Corps. President Obama's new leader of the National Health Service Corps is rebuilding and reinventing this program to make it more accessible, potentially even opening it up to people who would only work first time. So a myth is that if you go into this scholarship program, you have to go to the Aleutian Islands and break up your family. She is changing the Service Corps to make it much more accessible. You see many representatives here from the military. They also have programs where your urge to serve can play out at the same time as your education becomes affordable. So what is my doctor going to look like in the future? I don't think it's going to be Marcus Welby and Ben Casey, whom none of you know, but they were those black and white photos next to Meredith Grey. The doctors of the future have to reflect the people we serve, and you're well aware of the fact that this is steadily becoming the true melting pot, a true country with great diversity. I won't go through the statistics for you, but suddenly minorities become the majority in America in your lifetime. And medicine has to come to terms with that. We don't now. This is the relative makeup of medical students now, graduates in 2007. So we've got a distance to go. We're very committed to that. I think the website, a part of our website that you might find most appealing is aspiringdocs.org. It is designed to use the kind of media that you use and the kinds of stories you can relate to talk about what careers are like, especially for people coming from less traditional backgrounds. I'm very proud of it, and I really commend it to you. The face of medicine is also changing by this little fact of gender. I don't know for Dr. Pomeroy what percent of her medical school class was female. She says just a smidge. That was the case for me. Now it's roughly divided, and you can see it's starting to play out in the number of physicians in different age groups. There's a fact here, though, that we have to come to terms with in the profession, and it's another myth that medicine cannot accommodate part-time careers. The fact is, we're acknowledging that for both men and women, this is an aspiration. For some of them, it's a family reality. If you're both physicians and you have children and aging parents you're taking care of, it's pretty hard for you to both work 80 hours a week. So part-time careers will become more and more common, and I believe they will be accommodated. This is another reason why we need to build up medical schools. because the more people who work part-time, the more physicians you need. I applaud the fact that you want work-life balance. I think of the few things that can make medicine tough as a career, it's if you lose that work-life balance. And it's clear that the people entering medicine and people like you now understand that, and they rank it more highly even than their income aspirations. Young doctors don't want to just put in more and more hours to make more money, and I applaud that. The other way that medicine is changing is technology. I am an immigrant to the digital age. I require a constant translator. The most devastating thing to me was when my younger daughter went to college and I lost my tech support at home. You're comfortable. You're natives in the digital age. This will also transform the practice of medicine for you. What will it look like? I can't go into great detail, but I want to echo Dr. Pomeroy's sentiments. You know, last year, the majority of this nation was really ready for change. This summer, we had a kind of panic attack with the death panel ridiculousness. In early September, the president came back on television, and as he's able to do often, I think he's refocused it. And I can tell you that as recently as the day I left Washington, Congress is going to pass a bill around health care, but it will be mostly an insurance bill. You and I are going to have to partner to get at the rest of the problem, the social determinants of health that are so damaging to so many people in this country. Together, we have to take health care from where it's been. It was the world I grew up in, hierarchical, competitive, everything centered around me as the expert. The world you're going to create is going to look like this. It's one in which you are comfortable. And the thing I like about it as I age is you're going to put me as a patient at the center of that world. That's the healthcare world you're entering, and it will be fantastic. I will have a medical home. You, any one of you, may occupy any one of the roles in supporting my medical home, and I'm going to be skiing when I'm 95 because of you. Thank you very much.